Hello, everyone. My name is David O'Deege, and welcome to today's lecture on skin infections and allergic skin problems. In this session, we'll explore the most important medications, their uses, side effects, contraindications, and nursing responsibilities. This lesson is specially designed for nursing students, so get your notes ready. Let's begin. We'll be exploring Chapter 25, Skin Infections, Allergic Skin Problems, and Benign Skin Disorders. Skin is the largest organ of the body, and it serves as our first line of defense against infections and environmental threats. Any disturbance to the skin, whether caused by bacteria, viruses, fungi, allergens, or immune reactions, can lead to discomfort, cosmetic concerns, and even life-threatening conditions. As nurses, it is vital to recognize early symptoms, provide appropriate medication, and educate patients about skincare, hygiene, and prevention strategies. First, we discuss about skin infections. Skin infections may be caused by bacteria, fungi, or viruses, leading to symptoms such as redness, swelling, itching, or fluid-filled lesions. Understanding the cause of each skin infection is essential because the treatment varies. Bacterial infections need antibiotics, fungal infections require antifungals, viral conditions may need antiviral therapy. First, let's discuss topical antibiotics used for bacterial skin infections, especially impetigo and superficial staph infections. We commonly use mupirocin, which is applied 2 to 3 times daily for up to 10 days. Always clean the skin before application and avoid using it on large open wounds. Ritapamelin is another option for impetigo. It's simple. Apply a thin layer and make sure to avoid eye contact. Gentamicin is effective against gram-negative and staphylococcal infections, but watch out. If absorbed, it may lead to ototoxicity, especially in renal failure patients. Lastly, erythromycin is used for acne and strep/staph infections. The main concerns are mild burning and hypersensitivity reactions. Always avoid prolonged sun exposure when using this medication. Now let's move to systemic antibiotics used for more severe or widespread bacterial infections. Penicillin is frequently used for cellulitis. It's essential to ask about penicillin allergy history before administration. Cephalexin treats widespread impetigo, but again, be cautious if the patient has a penicillin allergy. Doxycycline is used for Lyme disease and impetigo, but always advise patients to use sunscreen due to photosensitivity. Avoid in pregnant women and children under 8 years. Clindamycin is powerful but can cause C. diff diarrhea. Monitor bowel habits closely. Linezolid and vancomycin are reserved for MRSA and resistant infections. These require CBC monitoring, renal monitoring, and watching drug levels carefully. These are serious medications, always assess for organ toxicity. Moving to viral infections. Most commonly, herpes simplex and herpes zoster. Acyclovir and valacyclovir must be started within 72 hours for best results. They may cause renal strain, so hydration is very important. Famciclovir is used for herpes zoster as well. Avoid in liver impairment. Gabapentin helps with post-herpetic neuralgia, mainly for pain control. Always monitor renal function and pain levels. For prevention, Zostavax is a vaccine given subcutaneously, usually to patients over 60 years old. It must not be given to immunosuppressed patients. Screening immune status is crucial. Now let's talk about fungal infections. Fluconazole and ketoconazole are used for candidiasis, taken orally or topically. The biggest concern is liver toxicity, so always monitor liver function tests. Miconazole and clotrimazole are common for tinea infections. Remind patients to keep the skin dry and apply for 1 to 4 weeks. Terbinafine, also called Lamisil, is used for nail fungus. Treatment lasts 6 to 12 weeks, and we must monitor liver and kidney function. Allergic skin problems happen when the immune system overreacts to substances like chemicals, foods, or environmental triggers. This response leads to inflammation, redness, itching, and visible rashes on the skin. Two common conditions include urticaria, also known as hives, and contact dermatitis caused by direct exposure to irritants or allergens. In the next slides, we'll explore the medications used to manage these conditions and how nurses can provide effective care. For allergic dermatitis, urticaria, and itching, we use antihistamines. Diphenhydramine is used for acute urticaria and itching, administered orally. It works fast but causes sedation, so patients should avoid driving or operating machinery. Cetirizine and loratadine treat allergic dermatitis, also taken orally with dry mouth as a caution, especially in the elderly. Cetirizine and loratadine are non-sedating options. Fexofenadine has minimal sedation and should be given with water, not fruit juice. For moderate to severe allergic skin problems, corticosteroids are extremely effective. Hydrocortisone is used for mild dermatitis, but prolonged use causes skin thinning. Avoid long-term use on the face. Triamcinolone is stronger. It treats eczema and moderate allergies. Systemic steroids like prednisolone or hydrocortisone are used for severe allergic reactions. Watch for hyperglycemia, hypertension, peptic ulcers, and monitor blood pressure and blood glucose carefully. Benign dermatologic problems are non-cancerous skin conditions that can still significantly affect comfort and quality of life. Psoriasis involves rapid skin cell growth, leading to thick, scaly patches, while acne vulgaris results from clogged pores and inflammation. Although not life-threatening, these conditions require proper management to prevent complications and boost patient confidence. In the upcoming slides, we'll discuss the medications and nursing care strategies used to treat psoriasis and acne effectively. For psoriasis, triamcinolone is used topically or by injection for its anti-inflammatory effects in psoriasis. Systemic steroids administered orally or intravenously are reserved for severe flares. In acne treatment, erythromycin is topical for mild cases, while doxycycline and clindamycin address moderate to severe acne. Isotretinoin is used only for severe acne and must be prescribed only by a dermatologist. It is highly teratogenic, so pregnancy is strictly prohibited during and after treatment. We should also monitor mood changes, liver function, and lipid levels every month. Thank you for your attention. We hope this presentation has provided valuable insights into the treatment options and considerations for managing psoriasis and acne effectively.